So in order to try and answer the questions related to the safety, potential safety of taking people off medications as they age, we designed a randomized, controlled discontinuation trial. This is presently underway in the United States, 15 centers in the United States, and we're looking at people who are 55 years of age and older, so relatively older. That's actually the top age for many of the studies that would be associated with getting approval of these medications, but it's the lower age for the study that we're talking about. So 55 and older and stable with no relapse and no scan change for at least 5 years. Although we're actually in the midst of changing that to every 3 years, for at least 3 years for the scan, leaving 5 years for the relapse interval. And then we'll follow people for 2 years after they're randomized, either stay on drug or go off drug. And this is essentially all of the approved, FDA-approved medications. We'll see. We'll measure relapses, we'll measure new scan changes, and we'll measure changes in disability, and we'll measure a number of different patient-reported outcomes as well. The main outcome is there an increase, is there a similarity or is there an increased risk of either a relapse or a new scan change, any scan change on a brain scan over the 2-year period of the study, and then all the other measures are secondary outcomes. So we've enrolled so far about 140 people at the 15 centers throughout the United States. We plan to enroll at least through part of next year, follow people for 2 years, and then we would hopefully have an idea, at least in that subpopulation, whether or not it is safe to discontinue disease-modifying therapies as we presently understand their use. There's plenty of data that suggests you really should not do this in someone who's, say, 35 and newly diagnosed, because the studies that have been done with those patients would strongly suggest that they're going to have a significant risk of recurrence of disease activity. So we explicitly chose relatively older persons who are relatively inactive with regard to inflammatory disease activity. So we'll see. We're very excited about seeing what the results will look like, but we have another couple of years before we'll see the results.